Hello, how are you? I'm so glad you're here. So today I thought I would just talk a wee bit about myself and about what I do because I'm conscious that I've made a few videos now and I haven't actually said um, what the kind of background is to them and why I'm doing this. So I thought I might just have a wee chat about that today. So again, we'll keep it quite brief. Again, we're getting further into December now when this is going out, so it's a busy time for everyone. So I'll keep it quite brief. So the background to me is well, I've worked as a physiotherapist for 20 years now, um, and I've always been interested in working with people who have pain and other long term problems. I've never been a physio that was interested in sort of quick fix injuries or doing a wee manipulation and getting you back out running again. I've always liked to work with people over a longer period and get to know them and build a rapport with them and help them get back to the life that they want to live as far as we can possibly do that. So I've worked in various different places across the NHS and in private practice. And last year in 2021, I left the NHS completely and I now work solely for myself in my own practice. And within that practice, I do a combination of what you might consider more regular physiotherapy and more specialist pain therapy. And this video series relates mostly to the more pain related um, therapy that I do, but it's not two distinct entities and there's a big crossover between the two. So, as you'll know from what we've talked about before, pain is never just a physical problem, it always has other parts involved because we're not just physical beings. We have a brain, and that brain likes to wheedle its way in and give us extra challenges along the way. So, pain is never just a physical experience. So, even if I am seeing someone in my more um, traditional physiotherapy role, if maybe after a broken leg or a stroke or something that would be considered a physical problem, there is always components of the mind body work there as well. And I always use components of that as I work with people because it's all to do with the whole person. And however much people might like to deny it, we are complete beings and we're not just physical beings. And no injury or illness or event is without a mind component along with the body component. So, because I've always been interested in that, I've done additional training in this side of things. So, I've trained with SIRPA, who is the main sort of body that does training in the UK for the mind body approach to treating things. And SIRPA was established by a lady called Georgie Oldfield, who is also a physiotherapist and who trained with Dr. Sarno in the States, who many of you will have heard of as being the sort of godfather of the mind body approach to healing chronic conditions. And then I've also done training with Alan Gordon, who is the author of the book The Way Out, which many of you may have come across. And if you haven't, that's a nice wee book to read. It's quite an easy read. So I've done training with him, and his theory is called pain reprocessing therapy. So that's the additional training I've done. So that's my kind of professional background. In terms of me as a person, as I say, I've always enjoyed working with people with long-term conditions, but I actually became a person with a long-term condition myself. Several years ago, I developed symptoms of fibromyalgia and found myself in the position that many of my patients had been, and I was then someone who had a long-term condition. And as a result of doing the additional training to help me professionally, to help my clients more, I actually got rid of my own symptoms. So I know this approach to long-term problems actually works. Not only has it worked for lots of my clients, it's worked for myself. I do not have symptoms of fibromyalgia anymore. And looking back now to childhood, I've had lots of different symptoms over the years that I can now put down to being due to mind body or neurocircuit or neuroplastic pain, whatever we want to call it. We'll go into that in another video. We'll go through all the different words. So as a child, I was always having stomach aches and nausea and headaches and knee injuries that wouldn't resolve, anxiety about going to different things. So at the time, I didn't know what it was, and certainly my parents didn't know what it was, and all the doctors didn't really know what it was. But now I know what it was. Now I know that this has all been due to neurocircuit problems, mind-body problems, whatever term we want to use. So that's a wee bit about me and where I'm at in terms of what I do just now. So I feel quite privileged in the sense that I'm able to look at these issues that people come to me with, both from a lived experience, because I've been there. I've not had the same experience as you, but I've had an experience of living with a long-term condition, of dealing with these different issues in my own life. I've worked with such a range of different people, which is always very interesting and very enjoyable. This approach is now expanding, and even just today I was meeting with a group that has formed of other people, other practitioners that are using this approach, and other clients that have used this approach to resolve their own symptoms of things like ME, chronic pain, recovering after injuries from chronic pain. So really a nice group there. We met today for the first time, so that was really nice as well. And the reason I'm making these videos is really just to try and get the message out there to more people that there is things we can do. You don't have to put up with the pain as it stands just now. There's different ways we can help reduce that pain, because even when there is a physical injury, it's never just physical. There's always other aspects that we can adjust as well. Often there's physical things we can do, but there's always things we can work on to do with the mind as well. So if you think a lot of the time when the pain persists, it's no longer due to damage in the body, it's due to the pathways that have been learnt by the brain, either forgetting to switch off or becoming oversensitised, and that's what's making the pain persist. And the thing is that these things can be relearnt. So there's always something we can do to improve symptoms that you're experiencing. So I'll leave it at that today. So as I say, that's just a wee bit about me and my background and why I'm here talking to you every week. So if you get any questions, as I say, I'm always happy to hear from you. Send me a wee message. I'd love to hear your own story, and if there's anything you want to ask me, then feel free. I'll do my best to answer it. Also, if there's any topics you want me to cover, again, just send me a wee message and I'm happy to do that if I possibly can. Okay, so I'll leave you at that just now, and I'll speak to you again soon. Take care. Bye bye.